I've been here for 25 years. One of the things that I've learned is the importance of access to health care. And too many of our neighbors and residents of East Contra Costa don't have the access they need to be able to take care of their health and their family's health. I'm Dr. Barbara Ben McCullough, and I'm the CEO of Brighter Beginnings. Together Toward Health was an initiative that was sponsored by the Public Health Institute, and it's a statewide initiative. And our project was focused on East Contra Costa County, and together with the East Contra Costa Community Alliance, known as ECCA, we worked together to implement the mission of this project and this initiative, which was to increase the vaccination rates among the hardest hit communities.
My name is DOREEN Moreno, and I served as the project manager and consultant for the Together Toward Health project. The East Contra Costa Community Alliance played a great role in helping us to develop a framework for the Together Toward Health project. We set up weekly meetings with our leadership team, again, to share ideas, discuss any challenges, but also to outline our progress moving forward. And also set up bi-weekly meetings with the TTH supervisors. It was highly important that they had a place, if you will, a space where they could share, again, their own ideas, but also be able to report to us any issues or challenges that were being faced, and also allowing us to be able to work more collaboratively together.
My name is BELETTE. I am the coordinator of ECCA. So the benefit of working with these organizations is the fact that they are trusted in the community. They're trusted by the populations they serve. The populations they serve also happen to be the most vulnerable when it comes to vaccine acceptance, vaccine accessibility. By making sure that we have the right organizations, we could have a greater impact in terms of providing them with the information they needed, because they needed to have information translated often in their own languages so that they are fully understanding what this whole vaccination program is.
Monument Impact know and work with this community. The village in another one, Contra Costa County in another one, of course, Brighter Beginning in other community. And together, we covered the whole county.
Especially when the pandemic, everybody just closed down and just kind of left the homeless, kind of by themselves. Because everybody, you couldn't go to the food place anymore, all that. And so really nobody knew what was going on.
We're at critical mass right now, with the numbers soaring. We are serving an underserved and economically challenged community. And both of those combined together at times causes those communities not to get the correct information.
COVID is not the only disease, illness, or virus that's out there. There's many community members that have diabetes, there's cancer.
Or community leaders or promotoras not only give the information of the vaccine. Right now, everybody lose something.
La comunidad latina en este momento está sintiendo un poco de incertidumbre.
They think that they'll have to go far away to get it, or wait in lines, or it's not going to be available to them. It's only going to be available to people with money or with a different income bracket.
Están asustados, están pensando en los niños ahora que surgió la vacuna para los niños. Si las personas adultas ya tenían miedo de vacunarse, y cómo esto va a afectar a sus niños. Porque ellos no saben qué es lo que se les va a inyectar. Y la gente necesita información.
Community members call me as to where they can get a COVID vaccine, where can they get tested for COVID. So on the top of my head, it's like, hey, there's Brighter Beginnings, and here's the address.
I've gotten 3 people in my car and took them over to the La Clinica, and we got the shots because I told them, I said, there's no reason not to have it.
The Ambassador program has partnered with Together Towards Health in many occasions. Currently, one of those partnerships was helping the Ellis Apartments in Concord. We were able to bring vaccines to the apartments. It first started with 6 individuals interested in getting vaccinated, and 42 people ended up getting vaccinated. 12 out of those were their first dose. We definitely saw the increase in numbers because the partners with Together Towards Health let a lot more people from the community know that the county was bringing vaccines, and it made a difference.
Sí, nosotros estábamos llenando esta encuesta. Cada que íbamos a algún sitio estábamos usando un survey para estar apuntando, poniendo y todos los datos de las personas, qué porcentaje de personas hispanas estábamos haciendo, cuántos de ellos habían tenido la enfermedad, cuántos habían contraído COVID, cuántos de ellos habían perdido algún familiar o amigo durante esta pandemia, cuántos de ellos accedían a vacunarse, a cuánta gente alcanzamos, con cuánta gente hablamos en cada uno de nuestros eventos que teníamos o de los sitios que alcanzábamos. Todo eso, toda esa data nosotros la estuvimos poniendo en ese survey.
So my name is Lucy Rios, and I was Brighter Beginnings Development and Communications Manager for 7 years. So developing the survey, we were very intentional in how we wanted to design this. From the beginning, the leadership team knew that community members are the experts to their own health. And so developing a list of questions, we wanted to make sure that the community leaders were able to ask these questions when they were in the field. We were tracking the responses as a leadership team on a weekly basis, and we were sharing the responses with the community supervisors in bi-weekly matter. And that was important because we were able to see not only as at a leadership level, but also as all the community organizations, the progress we were making and where things could maybe change or shift. So for example, if there wasn't that many outreach efforts in one city, we were able to quickly figure out, okay, like maybe we should shift our outreach to Byron or to Antioch. So once we had all of the data at the end, I mean, for someone that's learning data, it was like magic. We started seeing things that was in front of our face that we didn't realize. So for example, when we looked at the vaccination rates, who had already been vaccinated, who hadn't gotten vaccinated, we noticed that a large majority, about 85%, had stated that they had gotten at least one COVID-19 vaccine. And for us, we were excited that that was the reality of our community.
Is absolutely key and essential to have the right people. And it's not just the executive director of the organization that we're talking about here. We're talking about the line staff people. The community engagement piece works only if you have trusted individuals that are part of the community-based organizations.
We are community members. This is my community. I want to do whatever I can to help it. Money should be allocated to these community-based organizations because they are bringing the resources to the community.
The Together Toward Health project was able to actually provide direct and evidence-based messaging to our most vulnerable populations, and I think that is the strength and the power of the project.
This is an excellent project. This was a wonderful idea, concept, because we are listening to the pulse of the community.
This project is showcasing the power of uplifting community members' voices and having them play a role in finding interventions that work for their communities.
The TTH project has connected us together to save lives.
That relationship is solid, and that's what built the successes we had. And those relationships will continue to bring us together toward health.